It's one of the worst things that can happen to your training season. You're cruising along, you're kicking ass, you're killing it, sticking to your program, and then one day you get out of bed and it feels like you just stepped on the tip of a sharp knife and it's driving straight into your heel. It hurts so bad, and I'm talking, of course, about plantar fasciitis. We've talked about it quite a bit in the group. A couple people have mentioned that this is something that they struggle with, so I thought it would be really great to do a video about if you're suffering with plantar fasciitis pain right now, what can you do to really relieve that pain? I'm going to give you some tips, some stretches, some things you can do at home. Possibly you're going to be doing these in addition to working with your doctor and your physical therapist. But there are a lot of things that you can do if this is a problem for you that can really help you out and kind of save your training season in some cases. Because, yeah, it really just sucks to go running when every step feels like a sharp knife digging into your heel. And for those of you who don't know what I'm talking about, you're like, planta, fascia, what the French toast? Stick around, because I'm going to give you some prevention tips as well. This could happen to you. It's very, very common in runners, very common in people who do a lot of hiking and backpacking. So it is something that you should know about, even if it's something you haven't dealt with yet. So, before we dive in, for those of you who don't know me, my name is Sarah Maurer. I am a fitness coach who specializes in helping hikers get in the best shape of their life to prepare for hiking, backpacking, and mountaineering. So, welcome to my live video, and let's dive in to the topic. So first of all, what is plantar fasciitis? You might have this stabbing pain and really not know why, so I'll talk a little bit about that. So plantar fasciitis, if you kind of take a look at your foot right now, if you don't have a shoe on, run your finger along the sole of your foot from your heel to your toes. Right underneath there is a web of connective tissue that's called your plantar fascia, and that is it's actually pretty tough, pretty springy, and it's almost like the bow in a violin. It like connects your toes to your heel bone, and it creates the tension in your arch. So it's a very effective shock absorber whenever you're running or hiking or walking. Even every step, it's flexing. Say this is your foot. The plantar fascia is just plantar fascia stretches a little every time you step, and then it tightens and lifts up, and it absorbs just the enormous amount of shock that's coming down your foot with each step. And this is especially true if you're walking with a heavy backpack. Just imagine all the work that plantar fascia has to do. So it's no wonder that you can cause a repetitive stress injury to it fairly easily. So what will happen if it gets overused? It can get inflamed, it can get irritated, and it can start to have that stabbing pain that you notice in the morning. Some risk factors for this: if you have very flat feet or very arched feet. We'll talk a little bit about shoes and prevention at the end, but those tips are especially important for you. You just absolutely can't afford not to have awesome arch support and really good shoes. Possibly orthotics if you really have a hard time with your feet. Being overweight also just naturally can tend to put more stress on it. So if you're someone that's getting into working out for weight loss, just something to keep in mind. The shoes and the arch support are super important for you as well. And pregnancy, for whatever reason, pregnant women get this a lot, and it's actually the reason is because their joints are more lax because of hormonal changes. So there's a whole bunch of reasons that you might get it. Repetitive stress injuries really a contributor in almost all cases. And what are the symptoms? You might be like, well, my feet kind of hurt. Is it plantar fasciitis or something else? So the main symptom is a pain in the bottom of your foot that's going to be close. Usually it's closer into the heel, although some people, it radiates down the fascia towards the toes. Some people feel it in their arch or even further down towards the toes. And usually kind of a sign that plantar fasciitis really is what it is that when you get up in the morning is when the pain is most severe. The first couple steps that you take when you get out of bed are just like, ah! You almost can't walk. It's so horrible. And then as you start kind of walking around, making your coffee, the pain does subside a bit. And the same is true with exercise. Often if you go for a run, your first few steps will be very painful. And then as you get some more blood flow and it's warming up a little, that pain will subside. You can run pretty well. And then often afterwards, it will flare up and be quite painful again. So that's kind of the pattern to look for with plantar fasciitis. Hey Amy, one thing to keep in mind with plantar fasciitis is that you don't want to go too, for some people it's fairly, not a real severe thing. It's just kind of an annoying thing that their foot does now and then. But if you're having really severe pain that's, making it hard for you to work out and that pain does not subside, it's really important that you go and see a doctor. You can start with your primary care doctor, a sports medicine doctor, and often that doctor is going to refer you for physical therapy, which is awesome. Most people find that very, very helpful. And the reason you don't want to let it go is because you can make it worse. You don't want to be just like running and hurting yourself worse and irritating your poor fascia. And the other thing that can happen is you can actually, when your foot is in pain, you actually changes the mechanics of the way you run and the way you walk, and that can actually really mess up your other joints. So your knee, your hip can be affected, and that can cause a lot of problems for you. And it can be kind of hard to fix once your movement is compensated and all your muscles and neural patterns are kind of set to move wrong. So it's really important to get some help. You are an athlete. You're not like Joe Schmo that's sitting on the couch in Idaho and he's like, my big toe hurts a little. It must be the gout. He probably just hurts because he's sitting around too much. You are an athlete and, taking care of your instrument, which is your body, is so important. So, we all hate going to the doctor and it's lots of money in some cases, but don't let it go too long and don't try to second guess, treat at home, treat on the internet. Make sure you get the help you need. So that being said, if you are just, have kind of mild plantar fasciitis, you're not sure it's going to be a big problem, or if you're working with your doctor and your physical therapist to manage it, there are a couple of things you can do at home, and some of these are also good for prevention. So one of the first things that you can do is really rest the plantar fascia. And you're probably like, what the French toast? I got a big mountain to train for. I don't got time to rest. And you can actually train still. You just don't want to do things that aggravate your foot. So that might mean for a week or two, no weight-bearing activities. All your cardio you're going to do. Maybe you're going to go swimming. Maybe you're going to go out and ride your bike. Maybe you're going to get on the elliptical machine, which tends to be a little bit, if you can tolerate that and it's not hurting you, it's less impact on your foot. And you're going to use your same cardio routine, same heart rate zones that you would do if you were running or hiking, but in your same duration. But just get your cardio a different way. And obviously sport specific stuff is best, but this will also work too, and it'll keep you nice and conditioned so that, if your plantar fasciitis eases off and allows, then you can get gradually back into impact activities. So rest, non-impact activities, maybe 1 or 2 weeks, and then, do a couple of maybe an easy hike and see how you go. And if your foot is doing all right, you can gradually reintroduce hiking, reintroduce running if that's part of your routine, but very gradually, very slowly, and just kind of treating that foot really good. So giving your foot a rest, that's also called cross training. So cross training is a good thing to do even just once a week, even if you don't have plantar fasciitis, just to give your foot muscle a break. Number 2 thing you can do, elevation. If anytime you have a part of your body that is inflamed, irritated, sore, you want to elevate it. So what my physical therapist recommends, and I always thought this was really funny, she's like, most people just kind of prop it up on a chair or something. I just tried to put my foot in most people, but what she really recommends, she said, you know, go over by the wall, lay on your back, and actually put your feet up in the air against the wall. Hang out there for 15, 20 minutes, read a book, do that maybe 2 or 3 times a day if you're really having pain. And that really, talk about having your feet above your heart level, that really forces the blood to get up there to circulate. Really good for bringing blood flow to that plantar fascia so that it can start to, you know, it's bringing it nutrients and oxygen so it can go through its healing process. So elevation, feet up nice and high up in the air. It looks hilarious. Don't worry about it. Listen to a podcast, read a book. It's actually kind of relaxing. Do it at work. That would be awesome. Just be like in your cubicle. Like, I gotta elevate, man. Shoot, I think my phone, I'm worried my phone's gonna die, so I might speed up a bit here. Ice is another really good one. You can ice your foot, keep your sock on when you do this, and then you can either take like a bag of peas or corn that's frozen, or I like to freeze a water bottle and then roll my foot back and forth on top of it, and that actually feels really, really good. Like I said, keep your sock on while you're doing that so that the cold doesn't damage your skin, but give it a little bit of ice for 10-15 minutes a couple times a day. It tends to feel really good for pain. It's good for inflammation. And then stretching. Let me show you a couple. And massaging with a tennis ball. Same thing. You can, if you're kind of past the phase where it's really acute pain, but still kind of achy and sore, taking a tennis ball and massaging your foot with it, just running your foot over, back, forth, side, really getting it in the sore spots. That again, like helps like break up, you know, any like bad toxins, like helps the tissue relax, helps bring blood flow, helps just, you know, get everything like moving and flowing, and it really aids with your healing process. So stretches, let me show you a couple of stretches, and these are also really good for prevention. So you're going to want to stretch your calf muscles. There's 2 of them, the gastrocnemius and the soleus. I'm going to show you 3 stretches you can do for those, and what that's going to do, if you can lengthen those muscles, it actually they actually pull up on your heel when they're tight. So when they're relaxed, that actually takes some pressure off your plantar fascia. So it's really good not to stretch your calf muscles all the time, just thinking about the sports that you do. So let me show you. I'm going to step back here. I hope you can still hear me. I'm really loud, so probably, but as I knock into the furniture. So a gastrocnemius stretch, this is the upper muscle of your calf. You're going to basically just get in this lunging position and put your heel on the floor, straighten your back leg. Oh, come on, phone. Sorry. Hang on, guys. I'm just going to plug in my power source. Hang on. Just to make sure this doesn't die on me while I'm showing you how to stretch. Stay tuned. Oh, live video. Anything can happen, right? All right, so hopefully this will, hey Amy, I'll wave at you. So hopefully this will keep it going for a few more minutes. Okay, cool. So gastrocnemius stretch. Let me just get back in that position. Kind of in a, again, like in a lunging position. And basically you're gonna press the heel of the rear leg to the floor, straighten the leg, lean forward, and you should feel like a nice stretch going up the back of your calf, really hitting the upper part that's closer to your knee. A soleus stretch for the lower calf muscle. You're going to actually bring your legs in closer together, then bend both your knees, and you should feel a nice stretch. It's going to feel really different in the lower muscle of your calf. That's your soleus muscle. So you're going to hold each of these stretches for about 30 seconds. That will give you the full benefits of the stretch. So it's the soleus. And then another one you can do, you can find a step. I don't have steps in my apartment, so I'm just going to use my stepping stool. If you do use something like a stool, make sure that you have something to balance. I'm just holding onto the wall with one arm so I don't fall and hurt myself. And then I'm going to lower my heels one at a time, just about as low as they will go, and just really feel the stretch that stretches both of the muscles actually, and it also feels really good. So those are 3 stretches you can do for your calf muscles. I'm just going to adjust the angle here a little bit. Now for your plantar fascia, you can also stretch too. So let me show you a couple things you can do. I'm going to go back over here where you can see me. And I'm actually going to take off one shoe. These are best to do in your socks or bare feet because they involve stretching your toes. So the first one, I'm just going to lean. This is easiest to do if I'm just sitting in a chair with my heel on the floor. I've got my foot just lightly flexed, and I'm going to reach down, grab behind my toes, and just pull my toes back until I feel a stretch in the arch of my foot. And again, holding for about 30 seconds, feels really good. Stretching out that plantar fascia. Some people grab the big toe and pull it as well. They like, it kind of depends on, where your fascia is needing to be stretched, but you can try both ways. So that's one plantar fascia stretch. And then the other one that I think is really awesome, you do with a towel, and I'm actually going to sit on the floor. This is a good one to do if you're having a lot of pain before you get out of bed in the morning. I really hope you guys can see me. But what you're going to do is skip forward so you can probably see my feet. Is you're going to take something like a towel or a belt, wrap it around the ball of your foot, and just gently pull back so that you feel a stretch through the, whoops, and then it moves. You might have to make a little adjustment to get it right where you want it. Yeah, and just gently pull back till you feel a stretch through your calf muscle and then also through the arch of your foot in your plantar fascia. So hold for 30 seconds once again. Now, something to remember with all of these stretches is it's really important to keep them very gentle. They shouldn't, you should feel a stretch, but it should not be causing you any pain. If it hurts, you're stretching too much, and just, it does not have to hurt to work. Just, pull it very gently until you feel a stretch and make that, hold that for 30 seconds. Gentleness, so important. You don't want to make anything worse by hurting it or stretching it too far. So let me just double check, make sure I hit all my tips for you. Yep. So, and then the last one, I'm such a sweaty girl, like it's hot in here. I don't know if you guys have heard my story, but we have no air conditioning this summer. It's been crazy, so you get me all sweaty. I don't know, it's live video, you just get what you get on a certain day, right? And then the last thing, just taking Advil or other non-steroidal anti-inflammatories, so Aleve, Advil, when the pain is really bad. I wouldn't take it for prevention or all the time, but it's something that can help you get over a hump if you're just having like a really bad day with your heel pain and it's really aggravated. So it's definitely something to try. And then, so tips on prevention. I will wrap up with 3 of these. The first one is when you're starting a workout program and as you're continuing your workout program is to make your increases in intensity very gradual. Gradualness is so important. That's why if you're training for something big, like a big mountain, like a big backpacking trip, it's good to start a few months ahead of time. So you have time to just build up the duration of your workouts, the intensity of your workouts. You have time to build it up very gently. And kind of a good rule of thumb is about 5 to, when you look at how many minutes a week you work out and you should be logging it, make sure you're not increasing from week to week by more than 5 or 10%. Keep your increases in duration pretty gradual. And then every couple weeks, take a break. Have an easy week where you're maybe dropping back to 50 to 70% of your previous week's volume. That is going to be really helpful for you, and it's going to help to prevent overuse injuries. Tip number 2 for overuse, you must have amazing footwear. Like I said, you're not Joe Schmo from Idaho who sits on the couch, and you can't wear Joe Schmo's like $40 hiking boots from Cabela's. Like, You need to have if you're going to be out doing long backpacking trips with a heavy pack or mountaineering, you need to have the correct footwear for the job. So that's going to mean generally the better quality boots have stiffer soles. And you know, next time you're in the REI by the shoe rack, definitely like play with them, like grab a cheaper one and start bending it. People at the store will look at you like you're crazy, and then grab the most expensive one and bend that, and you'll probably notice the shank is much stiffer. It's hard to bend the boot if you grab it, the heel in one hand, the toe in the other hand. You can't really bend it in half. And then if you grab a mountaineering boot, they don't bend at all, but they're for a very specific purpose. So but for hiking and backpacking boots, good boots, they tend to be more expensive, unfortunately, but it's a good investment in yourself, in your future, and you know, injury prevention is so important. That can really just derail all your plans if you get a terrible repetitive stress injury. So good shoes, good boots. A shopping tip for you. This is what I do because I don't have time to like go to REI and try on like 10 boots. If you guys have not heard of Zappos, you want to discover that right now. It's an amazing website where you can order all kinds of clothes and things for your house, but shoes and boots, I think, is what it was famous for first. And the great thing about them is they have free shipping, and then they have free return shipping. So like when I was doing like marathon running and I was changing my shoes, like every couple months, like I would order like 5 pairs of shoes from Zappos, and then I would try on all 5 and I'd send back the 4 I didn't like and keep the 1, and it don't cost me like anything else. So I'll drop the link down below after the video, and you can give it a try and check it out. Definitely recommend it for you people who are busy training and don't have a lot of time to go shopping. Last tip for prevention, I mentioned insoles. Like Plantar, people with very high arches or flat feet tend to be more prone to plantar fasciitis. They just don't have the same ability to absorb shock. If it's real high, it's too flexy. If your foot's real flat, it's just smacking. So and even if you even if your arches are neutral or normal, you still will benefit from having a really nice insole in your boots. In fact, most high-end boot manufacturers expect that you're probably going to put an aftermarket sole or insole. I say sole. Sole's the bottom. They expect that you're going to put your own insole that's better into the boots. So the insoles that come in nice boots, particularly mountaineering boots, are pretty crappy. It's the same boot. It's the same insole that comes in Joe Schmo's gross boot that costs $40. So if you pull it out, you'll see it's like super floppy, super flat. There's nothing there that's really going to support your arch or cushion your foot. So where can you get a nice aftermarket sole? I've been for probably since I moved to Colorado for about like 17, 18 years, been using Superfeet. And if you're not familiar with that company, they make a variety of different kinds of soles. Some are, you know, I tend to get the one that is for people with really narrow heels. It keeps my heel from moving around, keeps my foot much more stable. They have ones with additional arch support. I will put some links down below once again so you can go and check it out. Definitely recommend that product. I have them in my backpacking boots, and then I have another pair in my mountaineering boots. They're actually the same kind, but they work great in both kinds of boots. So insoles, definitely think about getting something nice, cushiony, functional, as opposed to using the floppy made in China insole that probably came in your hiking boot. It'll give you, you know, just a lot more comfort and hopefully help to prevent repetitive stress injuries. So thank you so much for tuning in. I think Amy Lee is here. Amy, I hope you're doing good. What 14er is coming up for you? Did you guys hear my cat? He wants to be in the video. Let's turn it so. Yeah, he loves live video time. Like it's the most fun. Wow, I am like really red and sweaty. It's hot in here. Yeah, well, thank you so much for tuning in. And if you have any questions, definitely like drop them down below. I do, if you see this in replay, you can definitely still ask questions. I do check this for the next couple of days just to see what you guys thought. And yeah, good luck. I hope plantar fasciitis is not part of your training season right now. So, but if it is, you know how to manage it. So anyway, have a good one. Take care.